Good evening to all of our attendees who are joining us for the Arrive Together webinar. We're happy to have you joining us. I'm the Public Information Officer, Lauren Farinas of the Union County Prosecutor's Office, and I'm happy to get us started by introducing the Union County Prosecutor, William Daniel.
Okay, thank you very much. Good evening, everybody. Serve as your county prosecutor. I'm privileged to serve as your county prosecutor. And this evening, we have another community outreach event that we're engaging in at this time. And for those of you that may not know about the program we're presenting tonight, it is the Arrive Together program. It's an initiative that was brought forward by the Attorney General's Office, the New Jersey Attorney General's Office, Attorney General Platkin, in the summer of 2021, piloting with the great cities of Elizabeth and Linden and Chief Sockin, Chief Hart, respectively, to bring this program to Union County, partnering with Trinitas Hospital, as well as our office, the Union County Prosecutor's Office. For those of you that do not know what Arrive means, like I didn't at the beginning, Arrive means alternative responses to reduce instances of violence and escalation. And the focus of this program is to provide people in crisis with assistance as quickly and effectively as possible. The program aims to team a police officer, specifically an officer trained in crisis intervention, with a civilian certified mental health screener in order to respond to 911 calls relating to a mental health crisis. The purpose of this event here this evening is to inform the public about the expansion, the origination of the program to a certain extent, the current status of the program, and the expansion of the Arrive Together program in Union County commencing in May, that is this month of 2023. Again, as I stated, the program was originally rolled out in the summertime with Linden and Elizabeth actively taking part in the program. Officers from Linden and Elizabeth actively teaming up with a mental health screener through Trinitas Hospital, one of our partners, to respond to mental health crises type situations. We have a panel of experts assembled here this evening to give you some additional information on the program, some updates, and just keep in mind that this program would not be possible without the team effort of all involved. Now, those of you who are here this evening observing and learning a little bit more about this program, you're a vital part of our team as well. This simply could not be possible without the support of the public and the members of this panel this evening. So with that said, and knowing I will address you at the end of this presentation, I wanted to turn your attention now to a video that will be presented, and it's a video prepared by the Office of the Attorney General, providing you with some detailed information about the program. Following the video, the brief video, Derek Daly, Senior Counsel to the Attorney General's Office, who's here with us this evening, will address you and provide you with some more information. So once again, thank you. It's a privilege. I'm honored to be here. And again, thank you to all the panelists and you, the members of the public. Thank you. Okay, let's have the video.
into a society that doesn't look primarily to punishment and punitive responses, but looks primarily to human solutions. Humanity is everything. I think this is a good first step.
The program began in Cumberland County in December of 2021, and I want to give credit to my predecessor, Acting Attorney General Andrew Brock. And it began with a partnership between the state police, who provide the local police services in that part of the state, and mental health professionals in Cumberland County, as well as the Cumberland County Prosecutor's Office.
Cumberland County is unique in that we are a large county geographically. We have about 160,000 residents. Even though we're small, we have our fair share of crimes that come along with poverty. But when you are trying to break down silos and make systems collaborate better together, change policy and practice, and improve outcomes, it is a benefit to be smaller.
I was very happy and proud that they chose to launch the program and have discussions from the historic Trinity AME Church in Goulstown. Our pastor there, Dr. Michael Keene, is a mental health expert. And so it was the perfect convergence where it was faith, mental health, partnership, humanity within the context of a historic Black community.
We've not launched or expanded an Arrive Together program in any community without first sitting down with stakeholders from all aspects of the community and seeing what's working, what isn't. What do you guys think you need? What works in Cumberland may not work in Elizabeth, and what works in Elizabeth may not work in Atlantic City, and what works in Atlantic City may not work in Bergen County, and you go on down the list. We've done it with state police, we've done it with local police, we've done it with mental health professionals. We couldn't do this without the partnerships we have.
The foundation of law enforcement is protect and serve, right? The Arrive program speaks to the heart of that. Protecting the person that's struggling in crisis, serving, not only serving that victim, but serving that family and that community. This program is about serving our communities to the best of our ability.
We've been on the cutting edge of reforming our criminal justice system for decades now across administrations, and I'm honored to continue that effort. And I think Arrive is one of the best examples.
This partnership not only enhances the safety of our neighborhoods, but it protects our brave women and men in blue as well. There are so many people across law enforcement who deserve credit for all of this progress, but I cannot say enough about the leadership shown by Attorney General Matt Plotkin and the Superintendent of the State Police, Colonel Pat Callahan. Thank you, gentlemen, and let there be no doubt, New Jersey is a safer state today.
Good evening, everybody. Let me begin by thanking Prosecutor Daniel and the entire team there at the Union County Prosecutor's Office for hosting us tonight. It really is a delight to be here. And I should note from the outset, the video you just saw, though it is dated because there's many more municipalities and a lot more information to share about Arrive since that video was developed, it's important to note that Union County was featured prominently in that video for good reason. You saw Dr. Jones, you saw Chief Saka, and that's because since the very beginning, Union County has stood with our office and quite frankly has been a model for the rest of the state on how we can reimagine what public safety looks like in our communities. All of you are well aware that situations that involve mental health and behavioral health crises are precisely the kinds of situations and incidents that can go wrong quickly in our communities. They can escalate quickly and they can turn violent. And this program seeks to remedy that. And we seek to remedy that by doing a couple of things. The first is acknowledging that for far too long, we've asked far too much from law enforcement. We've asked them to respond to far too many calls. We've not provided them the proper resources and training to do so. And secondly, we have identified that we've not been able to respond directly to the crises that communities, residents in our communities face when it comes to mental health. When a person's having a mental health crisis, whether it's suicidal ideation or they're not taking their meds or they're emotionally disturbed, you name it, they don't need law enforcement. Like, they don't need punishment. They need a clinical approach. And so they need law enforcement officers who are trained in crisis intervention training, but more than that, officers who show grace and who have a heart for them and for the community. This program pairs those officers with mental health professionals to provide more of a clinical response to those situations. I should note that ARRIVE is more than just that co-responder model where law enforcement officials go out with mental health providers. It's also taken the form of a telehealth program in Atlantic City, where we've provided iPads to law enforcement officials when they're walking the beach or they're on the shore and they're in communities. They can provide those iPads to individuals and they can access virtual on-the-spot care with members of Atlantic Care, another mental health partner there in Atlantic City. In Mercer and Ocean County, starting just this month, we're rolling out a follow-up program where there's no law enforcement involved. And mental health providers are going out and following up with individuals who've been in touch with law enforcement to make sure that those individuals have the medicine that they need, that they have appropriate referral services and other supports that they so desperately need. So ARRIVE isn't a one-size-fits-all. It's a varied approach. It's layered. What we've seen in Union, though, is the kind of, it sort of speaks to what happens when you have the perfect synergy of community, law enforcement, mental health, all working together to achieve a common end. And that's why Union has been able to expand and scale so quickly. You'll hear more about the expansion in Union County, but I'm proud to say that Union so far to date has the most municipalities participating in this program in any county across the state. And that's a testament to the great work of the Union County Prosecutor's Office, but communities like Dr. Jones and law enforcement officers working together. When Prosecutor Webb McCrae mentioned in the video, breaking down silos, this is what it looks like. Union County is what it looks like when you break down silos and you drive people towards a common end. So on behalf of the Attorney General, we are just full of gratitude for Union County for really being the great model and the great partner that you've been. Trinitas, for sure, has been a great mental health partner. Two of those individuals who have been great partners in building up the Union County program, Chief Saka and Lisa Dressner from Trinitas, will join the Attorney General on Monday in Washington, D.C. At the Brookings Institution, where they will be featured prominently with the Attorney General and with researchers from Brookings to talk about the success of this program. I trust that all of you can go online and check out the report that came out maybe a month or so ago, but I would just lift up two quick details from that report. And that is that this program is not just good or successful because we say it is. Like, the numbers bear it out. You don't have to take any of our words for it that this program is changing lives. I'd encourage you to talk to the officers, talk to community members who have come in contact with the ARRIVE teams, and look no further than the research that Brookings Institution, what they did. They analyzed calls from over a year and found that for roughly 400 calls, no uses of force, no injuries, no arrest. That's success. It doesn't matter what part of the state you're in, that's success. And so we're proud of this program. We're fortunate that Governor Murphy has been a strong supporter of the program. As we've talked about, the $2 million appropriation that is guiding the expansion that is happening this month, which will be in 11 counties, over 40 municipalities across the state. Governor Murphy has also asked for a $10 million appropriation so that we can take ARRIVE statewide. If we're successful, ARRIVE in New Jersey will be the first statewide mental health law enforcement collaboration in the country. Once again, I think New Jersey is able to be a model for the rest of the country on how we can reimagine public safety. So with that, let me just say thank you once again on behalf of the Attorney General and our entire team. I can't think of better partners than Union County and those who are on the panel with me today. So with that, let me introduce one of those great partners who's been with us from the very beginning. That is Dr. Pam Jones from Union County. She serves on our ARRIVE Together statewide steering committee. She's been an excellent partner, a true value add. And so with that, Dr. Jones, I'll turn it over to you. think you're muted, Dr. Jones.
Thank you so much. I'm just so honored and so privileged to be a part of this. And I'm just sitting at the table with such giants who've made such strides. And I want to thank Union County for all of their hard work and every other area of the state of New Jersey for all that they have done to make this a great, great, great leading pilot program. Well, I want you to know, I believe that building mental health and having emergency responses built in as a program is highly important. And I look at it from a humanistic perspective. And being a part of the steering committee, one of the focuses that I have is to just ensure that communities are brought in as partners to be a part of this unit of service. You know, it takes a community, it takes a village to raise a child. Well, it takes a community to build a successful program. So with that in mind, you know, there's so many people that I encounter having a social services agency, being a pastor and working in the community and having services that we represent as an organization statewide. There's so many stories that are told each and every day about illnesses that are mental illness related as it connects directly to maybe an arrest or maybe an incarceration. I also work with women's reentry and have a program where we service more than 100 women each year. And so having that level of experience and then representing the community, I believe that it's necessary to have a community voice as a component. There are many families that are resistant in terms of calling the local forces to help, and they have a need and they remain silent and they don't know what to do. And media doesn't help that, and it creates a negative influence as it relates to families, especially people of color who are frightened by all of the news that comes about each and every day, experiences that are not so pleasant. But that's not every experience, that's just the few that are just magnified. And so what we want to do is to get community leaders and community organizations integrated into the process, because with the hurting families, they need a place to basically connect to resources and to have programming that will help support them after maybe they've had this encounter where there's been a triage of sort, mental illness, a police officer, and then finding out and determining a better way to address their illness. They're going to have needs in that family. There are triggers in families that make mental health illnesses just magnify. And to that, I want to say one thing. I've seen it happen over and over again, and to have resources, a connection to resources, to be that opportunity to connect those families in meeting their need, it lessens the stress and then lessens the triggers for mental health instances to arise. There have been so many instances where families have remained silent as a result of just not trusting, contacting anyone, and they remain silent in their homes. And then you hear all of the tragedy that happens. These experiences exist and occur when, if they had had the opportunity or the information or the trust from a community partner to help them to connect with the needed services, it would have not ended up in a senseless death. So I just want to say, with incarceration trends, especially with people of color, the statistics are showing that minorities have less access to mental health services. And of course, this helps to increase that. And it'll also help in just the whole process of diverting people with mental health illnesses to get the help that they need. You know, when someone has dementia and they become violent and they're arrested and some incident occurs that may seemingly warrant arrest, you know, when that person is ill, there's another opportunity to get that person with mental health care. And that's what families are seeking, and that's what we are promoting from a community perspective as a community partner. And so we're working very hard behind the scenes to get those community partners, those community leaders trained and informed, and together working with this particular program in order to make sure that there's a voice in the community, that people know about it, that it's not a well-kept secret, that it has an opportunity to have the access for these services to all, that they not only know about it, but they have the confidence in using it. And so thank you for having me as a part of the team. And I'm so excited about making this happen. So I'm going to turn it over now so that we can find out a little bit more about the process of it all. So I think it's Liz Dresner, Dana, and RP Officer Jessica Cambronero that will talk to us more about the process. I turn it over to you and thank you for your time.
Hello, everyone. Good evening. My name is Jessica Cambronero, and I am a community policing officer and Arrive officer with Roselle Park Police. I also serve as the department's special needs, mental health, and LGBTQ liaison. So my Arrive days are a little bit different than my typical work day. Typically, our Arrive days, our calls can come in one of three different ways. So one, a 911 phone call comes in that can be either a family member, a bystander, or the patient themselves that call in a mental health crisis. Two, you have a follow-up request by either an officer in your agency or an outside agency. That typically might happen if patrol went out to a resident, but didn't have personal observation that quite scaled up to needing a screener at that moment. So that officer might feel that the patient might still benefit from outside services or added services, so that might require a follow-up. The third way our calls can come in is recommendations by Trinitas. So the same way, either a family member or a friend might call Trinitas worried about a loved one, and that would require a follow-up. I truly enjoy my Arrive days. I love coming to work on those days. It's a great opportunity for me to be able to observe the screeners and learn new de-escalation techniques, new active communication techniques, and also be able to mimic that when the screener isn't with me. I would love to give success stories. Just due to privacy and HIPAA policies, I can't give you a specific scenario. However, what I can tell you is, as a department, we feel that this program is very prosperous, and our community is very grateful for that. I just want to end by saying mental health crises, they're not black and white. They're very gray. And mental health crises do not deserve a cookie cutter response. And the Arrive program provides an opportunity for law enforcement to be able to truly tailor our responses and deal with the mental health crisis with the time and attentiveness it really needs. And I am so excited for the expansion of it and to see how it grows. So with that, I will turn it over to Officer Raul Jordan from the Linden Police Department.
Hello, everyone. I'm Officer Jordan with the Linden Police Department. I've been an officer for 9 years on patrol, and I am one of the lead on the Arrive program with us. This program has been amazing since they brought it to us. I was happy with it because as one of the senior officers on patrol, I dealt with mental illness a lot, almost maybe 2-3 calls a day. And at that time, we didn't have the Arrive program. And with the Arrive program now, it helps having Trinitas right there to back us up. We're going to these calls. Sometimes I'm not able to get through to a lot of these individuals in crises, and Trinitas screeners, I have multiple, but I normally work with a screener named Glory, who's there to back me up, and she's able to get through to a lot of these individuals. I work with Elizabeth when I cross over into their district from time to time, and that's been a big help because a lot of times when I'm crossing over into another district and having that other officer to help back me up, it's been great. He's been able to help me out when they're not responding to me or even my screener. I think that the biggest thing with this whole program is the follow-ups. The follow-ups are great because we're reaching out to these people when they're not in crisis, just to make sure that they're okay before they get into that point and they're into their crisis. And we're dealing with them when they're not as guarded. It's really, really good. They're more open to talking to me, even when I'm on street patrol, when I'm not in my Arrive uniform, when I'm regular patrol. They're willing to talk to me and let me know what's going on with them. So I'm happy that the Arrive program is expanding. I can't wait to see what's going to happen. I love working with Trinitas and everybody else in the neighboring communities that are joining on. I can't wait to see what the future holds. So with that, let's bring Dana.
Thank you guys so much. I honestly have goosebumps because I wanted to take like a piece of every previous speaker from starting from the beginning and highlight what you guys have said. One of the things that I feel is the most important is about bringing a sense of safety to our communities. And a lot of us are members of our communities and we want to continue to improve the rapport. And so we have many stories, and as Jessica from Roselle Park said, we have to be very, cautious about sharing details. But if I could speak just for a minute, in a few instances that I have spoken, I haven't been able to speak about this, but the natural benefits of this program that were not necessarily the measurable outcomes of it or what we were looking to measure in terms of outcomes, and that's trust, respect, dedication. I feel that our responses in the communities that have been piloted to date on the off arrive hours, and this is where I think is the most important, has improved and strengthened because we feel safe, all of us, all of the partners reaching out to each other and speaking about real things and raw things and hard things, but most importantly, what we can do for the family.
Okay, looks like we lost Dana there. She may pop back on. So we can just keep going, and when Dana comes back on, we'll jump back over to her. Our next speaker is Elizabeth Police Chief Giacomo Sacca. Please go ahead to speak on, I believe, the statistics of the program and how it's been working in Elizabeth.
Yes, thank you. Good evening, everybody. So when we started the program in Elizabeth and Linden, we started back in June of 22. And the reason why we started it is that police are involved in the calls for service with mental health, but law enforcement solutions aren't always the correct answer. So thankfully, this program came along that gave us the tools that we can use to now either get someone the help that they need or do follow-up so that we're preventing future calls for service. So since the program has started, the Arrive team in Elizabeth has made 232 cases. And of those cases, we track as much of the information as possible to see if we can even fine-tune the solutions. We track how long it took the Arrive team to get there. We track how long the police were on scene totally. We track the total amount of officers that it took to complete the job. And we're happy to report that in those 232 cases, only 2 of the instances required the use of force. And when we say use of force, every time that a police officer does anything to a person that's beyond escorting them or beyond moving a limb for an arrest, it has to be reported. So in two of those instances, two people had to be restrained in order to go to the hospital. Nobody out of all 232 cases that we've had so far, nobody has been arrested. Nobody has been charged with any criminal activity. And the two people that did go to the hospital, one of them was bipolar and was throwing objects. And then the other person had fled from the police upon arrival, and they weren't made contact up until we found them two other jobs later, and the person was violent directly from the beginning, but they were restrained and taken to the hospital. So out of 232 jobs, 2 instances of use of force, no arrests, no charge, and on 25% of the 232 jobs were follow-up visits, where the police officer and the Arrive team went back to the houses to contact the people to make sure that they were doing better, that they were continuing to take their meds or were getting the resources that they needed. So that's the completion of my statistical report. And thank you everybody before me for laying it out and all the kind words. But this is something that it has to be done in law enforcement. Just a matter of getting the correct resources out in the field. So we really appreciate the program and all the efforts from the community and the operators. With that, I'd like to introduce Assistant Prosecutor Wilson to give us the more information on the Arrive program.
Thank you, Chief. Before I start, I'm going to let Dana maybe finish a little bit of what she was saying, if she wants to.
Honestly, I'm just not surprised my internet went out right when I was talking, but I was just really excited to introduce Chief Saka because he has been such a vital role in this. And Officer Hart has been a key player in coordinating all of the efforts amongst, along with the rest of the department. So I just wanted to say that. I was excited.
Thanks, Dana.
Thank you.
Thank you.
Thank
So,
you for everything.
As you can see, Dana and Trinitas have been a great partner for our Arrive Together program. You heard her mention Officer Hart. So Officer Hart is actually the Arrive officer in Elizabeth, but we've all heard the name Hart before. So Chief Hart is our chief in Linden and was also one of our pilot programs and a great proponent of Arrive and a great champion of the program. So as Chief Saka said, I'm Tiffany Wilson and I'm an assistant prosecutor in Union County. And for the last decade, I have dedicated most of my career to dealing with individuals who have a mental illness, and that mental illness has caused them to be involved in the criminal justice system. So when we heard about Arrive here at the Union County Prosecutor's Office, it was a natural fit for us. And because we've done over, as an office and as a county, we have spent the last 15 years making sure that our officers are well trained in handling mental health crises and de-escalation and sensitizing ourselves to avoiding the stigma that might be related to somebody who has a mental illness. And I think Chief Hart and Chief Saka, and then our former and current chiefs in Roselle Park, who was our third pilot county and where Jessica is from. I think that's a testament to the dedication that we in Union County have had to this type of work. So when Arrive came along, Chief Saka and Chief Hart jumped right on board and said yes to it. And we are eternally grateful for that. And we are eternally grateful to the Attorney General's office for picking us to take part in our pilot, and to allow us to expand in December. I hope you all have gotten a good idea of the Arrive program, just to give you a little bit of the nitty-gritty of what it looks like on a normal day. So Arrive currently runs 3 days a week, Tuesday, Wednesday, and Thursday in the cities of Elizabeth, Linden, and Roselle Park. This month, I am pleased to announce that 8 additional municipalities in Union County and a total of 14 police agencies will join the Arrive family. Through the hard work and commitment of Trinitas, as well as the Union County Commissioners and the leadership of the municipalities here in Union County, we will go from having 1 Arrive car covering 3 municipalities and running only 3 days a week on the eastern end of our county to running 2 Arrive cars 5 days a week covering 11 municipalities. So for those of you who know Union County's geography, that is more than half of Union County's municipalities. Joining Elizabeth, Linden, and Roselle Park, Union County Arrive will now expand. This is in alphabetical order, not in any other, not giving anybody else any other credit. We will join Berkeley Heights, Cranford, Fanwood, Mountainside, New Providence, Plainfield, Scotch Plains, Westfield, and then the Union County Police Department and the Union County Sheriff. When we decided to expand, and we had the opportunity to do so because of the $2 million that Derek mentioned earlier, we really had 2 goals in mind for this next part of our pilot. We wanted to address a really true need on the western end of the county, which exists because our county's screening center, which is Trinitas, is all the way to the east, and Plainfield is all the way to the west. And moments of real need, the time, we noticed moments of real need based a lot on the amount of time it takes to get from here to there. And we know that that time can really make a difference for an individual that's in need. And it can make a difference between a situation escalating to the point where we then do need a true law enforcement response, or where someone could get hurt, or where someone might need to be committed involuntarily to a hospital. And our goal is to avoid all of those things. So when we recognized that need, we knew that when we were going to expand, we wanted to make sure that our western municipalities were our next focus. And we have done that with this current expansion. Our second goal was to see how we could make the Arrive model work with smaller municipalities. With fewer available officers, how does a small town commit an officer once a week? Even if it is a great program and it saves resources elsewhere, that's a real concern for really small towns. So this time we are piloting a shared day where towns like Fanwood, Scotch Plains, Berkeley Heights, New Providence, and Mountainside are pooling their human resources to cover a day of the Arrive car. And then our county law enforcement, our county police, and our county sheriff, with the support of our commissioners, have stepped in as well to cover a day. So while we've dealt in our current pilot with somewhat larger towns, the Roselle Park will say they're a little small compared to Elizabeth. So right now we're dealing with that size of a town. In our next expansion, we are modeling a model that can allow these towns to share their resources, and we're going to see how that works. We have learned some lessons from our original pilot. As we speak, our teams have just begun utilizing a statewide data collection system. So we can all benefit from the work being done around the state and learning lessons from everywhere. We have learned that the follow-up work, and you've heard a lot of talk about that today, is really important. And that it's being done by our Arrive teams right now with our screeners. But as we expand, our screeners will be busy with additional towns. So we know that we have to prioritize in this next phase other ways that we can get follow-up help and follow-up assistance to the individuals that the Arrive teams are interacting with, or individuals that have been identified by local law enforcement, the community groups, and Trinitas. So we are right now working with and communicating with Bridgeway Rehabilitative Services to see how we can bring them into the Arrive fold and have them provide some of the follow-up services that our screener is providing now, so that our screener can deal with our more serious calls, our more serious mental health calls, and can still travel in the Arrive car with our additional towns. These types of partnerships continue to be formed And as more municipalities join on, they will bring the partners that they work with already to the table. And we are really excited to see that expansion. We have also learned that there are several models for Arrive throughout the state. And while we are very dedicated here in Union County to our very successful model of having an officer in the car with a screener, we are also watching those models as we set an eye toward further expansion and continue to review the data as this expansion rolls out. So right now, our cars run from 12 to 8 o'clock, Monday through Friday. But we know that there are many more hours in the day and more days in the week. So we are looking to some of these other models to see how we can use what they've learned and what they've discovered to enhance our current Arrive program and help to cover those hours as well. So to our partners at Trinitas, to the Attorney General's office, to each of our chiefs and directors that are listening in tonight, to the governing bodies of each one of those municipalities, and in particular to the Union County Commissioners who supported them, I am really looking forward to continuing to do this great work. We all truly believe that innovative programs like Arrive Together help make us all safer and make us better neighbors. So with that, I am going to, I am going to turn it over to Lauren for a video from our Commissioner Chairperson, Sergio Granados, who has been a true partner and champion and friend to all of our programs here at the Prosecutor's Office, particularly those related to mental health, but so many others of our programs, but in particular, a true partner and friend to the Arrive program, and has committed anything that basically anything we've asked him for so far. So we won't take too much of advantage of that, but so far he has been a true supporter, and he has some prepared words for all of us because he could not make it here today. And then after that, I will turn it over to Prosecutor Daniel for closing words.
I'm sorry I could not be there for the Zoom discussion on Arrive Together, but thank you for allowing me to submit a few words. Stepping Up to Mental Health is an initiative that has been at the forefront of my 2023 Chairman's Building a Stronger Union County theme. When I first heard about the Arrive Together program from Prosecutor Bill Daniel, I knew it was something that we wanted to expand throughout our entire county of Union. That is why the Union County Board of County Commissioners has been working closely with the Union County Prosecutor's Office and the Sheriff's Office on ways to do so. With the help from the state and the Attorney General's office, as well as funding from the County of Union, I'm excited that we are able to expand to 8 additional towns, along with the 3 towns who are already part of the pilot program. The focus of this program is to bring effective and truly instrumental services to not only our residents who may be in crisis, but to our own police officers across the county. Having someone who is specifically trained in crisis intervention and officers who are fully trained to assist in critical moments when responding to 911 calls relating to a mental health crisis. In times of tension, this can help de-escalate a situation and avoid the use of force, which is the outcome that I know that all our police departments are always striving for. We're happy to see that Union County is the first county in New Jersey to expand to so many municipalities, and I'm hoping in the future we're able to include all 21 towns in Union County. This program is a win-win for both our law enforcement community and our residents countywide. And I would like to thank everyone involved for bringing this program to Union County and for the partnership with the state, Attorney General's office, and of course, our Prosecutor's office, Sheriff's office, and our local police departments. Thank you.
Okay. All right. Can you hear me, Lauren, and everyone? Okay, great. I just want to echo in part Chairman Granados's comments. Thank you to all of our team members. The members of this team arrived together. We couldn't, together we can accomplish anything. Alone, we're never going to achieve our goals. And this is a perfect example of that. Chairman Granados, I too would love to see this program expand throughout the county. And that is a long-term goal that we can, I know we can accomplish. I'm so happy that we have 8 additional towns signing on now. That that makes 11. There's 21 municipalities in Union County. We're well on our way, as with many other projects. Now, this is a team. This is a team effort, but I think perhaps the most valuable member of this team is it consists of the many participants who are here interested in this program, expressing an interest in this program, expressing an interest in your community by attending here tonight. And I urge you to spread the word of this great program. The snowball effect will continue to accumulate and the message will get out there to the community. I thank, on behalf of the team members, I thank you, the members of our community, for accepting us into your communities, which all comprise a smaller part of our community here in Union County. And just spreading the word about this great program. Thank you to each and every one of the participants here. Thank you for your leadership. And let's continue moving forward. Thank you, partners. Thank you, community members. And that concludes my comments for this evening. And Chief Saka, sir, good luck in Washington. Well deserved, and so proud of all of you. Thank you. Thank you, Lauren, for setting this up. There'll be many more community events coming up, and we will keep you all posted. All right, together we can make a difference.